guys, I just wanted to give you an update. So I finished my surgery rotation. I finished last week and it was overall a good rotation. I did have to get up at 2 a.m. sometimes, so that was less fun. But I learned a lot. I had never really scrubbed into an OR before, so that was something new for me. And then I also was able to remove a drain, so that was an interesting thing to also be able to do. So you have to remove the sutures and then you remove the tube. And then there were other wound stuff and things like that. So there was a lot of new things that I got to see and learn. A lot of focus on drainage. So if you have, you might need to drain fluid from the gallbladder. Similarly, you might need to drain fluid from a lung, stuff like that. So got to see a lot of drains on the fluid output and the significance of it. So it was a very educational clerkship, but also very long hours. I did get to learn a lot, so it was a good thing that I did it, even if in the moment I wasn't excited to get up at 2 a.m. sometimes. Then I did clinic, and so in clinic I have that 2 days a week, and basically you see the patients after they've had surgery and been released from the hospital. So it's things like drain removals, seeing how a wound is healing, assessing patients for seeing if they need surgery as well. I did clinic, and so in clinic I have that 2 days a week. So you can see there's a breast clinic, so patients with breast cancer. Basically you see the patients after they've had surgery and been released from the hospital. So it's things like drain removals, seeing how a wound is healing, assessing patients for seeing if they need surgery as well. Once a week I did consults. So if any of the other services in the hospital, like internal medicine, family medicine, if they had a patient they wanted surgery to look at, then I would go see the patient. I also was able to go to these trauma things. So you have a pager. So the medical students who were on consults, they would have this pager. It's called the trauma pager. And whenever there's a trauma, then the students can go to the trauma. So I got to sort of observe how trauma is run. Sometimes you're on the OR, so then you go into the operating room, you scrub in, you can help with things. So I was able to see some different surgeries. I saw an amputation. And then you can see the patient afterwards too, so that's sort of exciting to see the patient before and after surgery. I also wanted to let you know I got my second vaccine dose, so here's a video of that.
Then I would suggest people that take your personal one just so it doesn't
And after the vaccine, I got a fever of 102.5. But it went away. I also had loss of appetite, a lot of fatigue, and stuff like that. But then afterwards, I was fine. So I think it's worth getting the vaccine whenever it's offered to you, because even I don't think that I have a high chance of having a problem if I got COVID. I mean, healthy people of my age also have died from COVID, but I would think my personal chance is probably low of having severe death or something from COVID. However, I think it's still worth getting it because it helps decrease the spread a little bit. I don't think that there's any studies out yet that say exactly how much getting each vaccine is going to decrease the spread of COVID, but it makes sense that if you have a lower chance of carrying viral particles, then there's lower chance of you giving the viral particles to other people, and most definitely it makes sense that there would be a less chance that you're giving as many viral particles away if you have less viral particles to give. So I think that it makes sense that the vaccine would decrease the spread. So I think it's still worth getting it even with the reaction that I had, so highly recommend you get it. And I can make a video on the different vaccine options that the US has, if anyone is interested in that as well. how they're made, how effective they are, stuff like that. So let me know in the comments if that's something you'd like me to make a video on. So anyhow, thanks for watching. I'm doing internal medicine again. I think I'm gonna change the videos I'm making. Instead of talking about each rotation the second time I do it, I think I'll try to make videos on other topics that might be relevant. So like maybe summer programs or something like that that might be relevant and not just a repetition of the videos from last semester. Well, take care. Bye. Don't forget to like and subscribe to my channel.